So I'd like to lead into maybe the big question. This is the question I get all the time, and I can give my layman answer, if you will, but it's not nearly as good as your answer from an MD. So I'll tell you, I'll lead it off with this. I was in an open enrollment meeting or an education meeting once at Merrill Steel, and I was talking about how we can purchase, say, orthopedic surgeries, for instance, for 20, maybe, give or take 20% of what you would pay at the hospital. And that this, and one person who's kind of a jokester, and he kind of spoke up and he said, "So is this at Motel 6? Ask for Vinny in the back." And we all laughed, including me. But can you shed some light on this topic of how in the world can you offer high quality, if not better quality, surgeries, but at such a fraction of the price of hospitals?
Sure. Yeah, as I've sat in the operating room over the years, some smaller, some larger, you see a lot of things that the hospitals leverage nursing staff and other staff internally to do a lot of their billing, et cetera. And you start to hear these things going on where, just for an example, smaller hospital, rural hospital, doing a knee arthroscopy, or I'm sorry, an ACL repair, needed a knee immobilizer at the end. And I think one case we did that was about $200 because you sort of see all the billing that they do internally, or you can if you're interested. Most people aren't interested. I was always interested. And one case was $200. Subsequently, the hospital lost $3 million in rural subsidies. And the same knee brace, I think they charged out at like $1,000 in a different case. And so it really is true. And we sort of joke about it on the back end as well, but there's this charge master that people always talk about. And I envision this charge master of sitting on a little round table in a dark room with a beam of light coming down on it as the Bible, and they can just page through and change prices as they want. And the reality of it is that's exactly what it is. Without all the sort of optics around it, but the prices are changed according to what the needs are. And so when you see these things and you start to realize what the true cost of healthcare, and you realize that honestly, when you look at a direct primary care clinic as well, you look at, for instance, buying 1,000 pills for $16. And so your prescriptions are maybe around, 40 cents a month or $1 a month. The same is true on the surgical supply side of things. And so that's how, when you really get into the nuts and bolts of what a surgery is going to cost, it doesn't cost as much as they say it's going to cost, but they're billing all this additional pork, if you will, to pay for a lot of other things, including, CEO and all the executive salaries of $13 million, $10 million, and so on down the line as these people progress down. And a lot of it too is just the building that associated with sort of these not-for-profit. And you mentioned Keith Smith, who I consider sort of the godfather of non-insurance-based surgery. And he will often tell you that he doesn't call it a not-for-profit, he calls it not show-a-profit. And that's exactly what they are, because they have to continue to spend this money in such a way that they're building all of this excess. And so when you start to have all this real estate and all these additional clinics and things like that, you start to have to charge more money. And the insurance companies will bear that cost and continue to pay for it. So again, from our standpoint, when you look at the back end of it, we know exactly what the costs are. We control those costs. We control the real estate, and therefore we can offer these surgeries at 70 to 80% less than the hospitals do.